Yes, Neethu Sajikumar. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Today we have Neethu Sajikumar from India. She's a nurse by profession. Today we are going to do this speaking session. A patient, a waitress diagnosed with type 2 diabetes, wedge resection 12 days ago and has a post-operative infection large toe, Staphylococcus aureus. Okay, fine. Neethu, are you ready?
Yes, sir. How may I address you during the role play, sir?
You can call me Maggie, waitress. So Margaret Thatcher is my name and you can call me Maggie.
Okay, sir.
You can start now.
Good evening.
Good evening, nurse.
Is this the house of Miss Maggie?
Yes, you are absolutely right. Come on in. Please have your seat.
Okay, thank you. My name is Neethu Sajikumar, and I'm one of the registered nurses working in the community health center. And I'm here to change your wound dressing. So, Maggie, tell me how you are doing today.
Nurse, actually, I should have followed the surgeon's advice, but I did not. So now I have this infection, nurse. I don't know. I'm not well. I'm really upset about this situation. Can you help me, nurse?
Yes, Maggie, try not to worry. I am here to help you. Okay. So I also found that you are having Staphylococcus aureus infection. So you know one thing. The fact is that sometimes people may get the post-operative infection, but that is not their fault. Okay. So I know that you are following uh, your post-operative requirements. So I can assure you that this is not your fault. Okay, are you following me?
Yes, nurse. I'm following.
Yes, Maggie, nothing to be well alarmed of. The Staphylococcus is a gram-positive bacteria, and it can be spread easily through the cut and sometimes through the skin-to-skin contact. So I can tell you that don't worry regarding your current stage. It can be spread easily. So try not to worry more. Okay. So. So I know that you are going through a difficult situation. So could you please tell me more about your general habit after the operation?
Nurse, actually, I need a quick fix. I don't want to waste my time. I want to fix the toe immediately, as soon as possible, because, I need to get back to work. I don't want to sit at home because the antibiotics aren't actually working.
Yes, Maggie, I do totally understand your situation, but please be patient. Okay, I can assure you that with proper wound care management and along with this antibiotic, your wound will completely healed. So please be relaxed. And one thing, the antibiotic may take time to get work effectively. So I would like to tell you that please take the antibiotic properly so that you should have a good recovery from this problem. Is that clear?
Yes, nurse, but okay, I agree to follow your suggestions. All the suggestions I'm ready to follow. And I accept that I did not cause my own infection. I'm not the reason. I took all the care possible, but I don't know why I face this problem, and I'm not to be blamed for this one.
Yes, Maggie, you are absolutely right. This is not your fault. Sometimes it may develop due to some other conditions, like you already have the diabetes, so that might be the causes of this problem. So don't worry. Anyway, you take all the medications, so you may have a good recovery after some time. Okay, so for that, I would like to give you some suggestions to improve your problem. So is that okay for you?
Yes, nurse, of course.
So,
But I want to tell you that I know the risks of diabetes, the diabetes patients experience with circulation. But I would like to have a brochure on how to manage my illness.
yes, Maggie, I can definitely help you for this. You are absolutely right. The type 2 diabetes has a risk of circulation problem because the diabetic patient's circulation goes down, and which make their body to deliver the nutrients, as well as there is a delay in the wound healing. So don't worry, for you, you are on diabetic medication, so don't no need to worry more regarding your current diabetic state. Okay, so I would like to remind you that please make more attention on your dressing. So a protective covering should be applied while you are going to the bathroom and while you are walking, so that your wound not get wet, as well as it is good that to get exposed with the fresh air for a time, and it is important that please expose your wound with the sun, so that all will help for your healing. Okay, and along with this, please make sure that you are taking the antibiotic properly. Okay, Maggie, are you getting my points?
Yes, nurse, definitely. I'm going to follow your suggestions and I will implement seriously.
Okay, Maggie. So I will give you a booklet also. So in that all the details are written there. So you can go through that brochure on your free time. Okay. And I will call you on next week. Thank you.
Yes, nurse, thank you very much.
Okay,
Have a
thank
nice
you.
day.
Okay, thank you, Maggie. Thank you for listening me.
Okay, so shall I give you some feedback points, Neethu Sajikumar?
Yes, sir.
Okay, let me tell you. Yeah, now the first thing is your overall presentation. It was fine. It was absolutely fine. But the point is, you have to focus. You have to focus. Okay, you have to focus
Okay, sir.
on pronunciation. You have to focus on pronunciation. Now, what is this pronunciation? Let us see what is this pronunciation. So, in pronunciation part, there are many aspects, but I'm going to tell you a few things now. First thing is you have to avoid that pauses and breaks. You have too many pauses and breaks. Is that clear?
Yes, sir.
Then next, number two, you are saying like this, oh, like that. That is one more thing. So these are called unnecessary sounds. Unnecessary sounds. You have to avoid unnecessary sounds as far as possible. Next one, fluency. What do you mean by fluency and what do you mean by accuracy? Fluency is that one which at a flow you speak, like how I am speaking from the beginning to the ending without any stop. Unless and until any necessity is there, I will not pass. And if there is a necessity, I will stop. What do you mean by pauses and what do you mean by stops? So now, when you are speaking, besides that, pause. Besides that, you have to take your medication. However, exercises should not be neglected under any circumstances. Therefore, pause. Therefore, if you follow all these measures seriously, you can see a lot of progress and development. So like this, you have to speak in a fluent manner. This is called fluency. Accuracy is related to grammar, pronunciation, and other things. Okay, now coming to the point, pronunciation. How are you going to improve your pronunciation? You can listen to the audios and you can repeat after them. So that's the way how you can improve your pronunciation. Now grammar. Grammar you can learn. Of course, there are some mistakes, grammar mistakes, pronunciation mistakes, vocabulary mistakes. You can always improve on those areas. Next one. Your sentences are not very qualitative sentences. They're just ordinary sentences. You can make simple sentence, complex sentence, compound sentence. How can we make those simple, complex, and compounds? Let me tell you one thing. So here, if you join 2 or 3 sentences using conjunctions, then that will be a complex or compound or simple. Now, for example, 2 sentences. If you, okay, medication compliance is necessary. Your health will improve. So, but you did not follow this medication compliance. Okay. So how you are joining these 2 sentences into one sentence? Okay. In case medication compliance is managed or maintained or followed, okay, compliance with medication is mandatory for excellent progress. Medication compliance is extremely necessary for improving your health. Okay. So if you follow, if there is medication compliance, the more the medication compliance, the more the health condition, the better the health condition. So like this, you'll add sentences. If medication compliance is maintained well, then progress of health can be assured. Like this, 2 sentences can be joined. We can notice that medication compliance is followed or managed or maintained seriously, and therefore his health condition is excellent. So now you understand, Neethu, Sajikumar, how I am joining sentences?
Yes, sir.
Unless and until unless and until medication compliance is maintained, the health condition cannot improve. So like that. So you have to this next one, you have to practice a lot of sentences, and every day I'll be calling you. Whenever you are free, I'll be calling you like this, and you come open, be bold enough, be bold enough. The world is watching you. Be bold enough, prepare well, practice. If you don't know in the initial stages, prepare for half an hour and come, no problem, I don't mind. But in the test, whenever I take test on Saturdays, that day only in front of me, you'll sit and 3 minutes, you'll prepare and you'll come. That's all. You understand now?
Yes, sir.
Be bold enough. When you are afraid, you will always be afraid. Anybody in that manner. I'm not telling you. You are bold enough, you came here. But I'm talking about the many other students who are going to come in the next sessions and follow up all these practice sessions. Okay, next one. Every day you will listen to this. Then afterwards, these videos I'm going to put in the YouTube and a Telegram channel and our WhatsApp. So you can watch those others also. You understand?
Yes, sir.
How others are speaking. Don't waste your time. It is not my cup of tea. Don't think like that. You have to go there, listen to them, and whatever sentence or word or vocabulary they are using, try to write down on your own. And then you try to use those words if they are extraordinary words. You understand what I'm saying?
Yes, sir.
So if you want to add quality, you have to listen to others and you have to practice those things. Okay, fine?
Okay, sir.
Okay, dear. So that is done. Now you can leave.
Okay, sir. Thank you.
You have anything to ask?
No, sir. Thank you so much.
Are you happy with the feedback?
Yes, sir. Definitely, sir.
Yeah, you go, and if you want afterwards, if nobody is there, you can raise your hand after half an hour. If anybody is there, I cannot. So morning one, afternoon one, every day I will give you one speaking session like this. Okay.
Okay, sir. Thank you so much.
If you prepare well and come. Okay.
Yes, sir.
Okay, dear.
Thank you.